So word lists are a very useful thing.
Dr. Gilbert Ho reviews the test he gives to patients he suspects may have Alzheimer's. It's part of his robust process at the Pacific Center for Neurological Disease in Poway because there is no one way to diagnose it.
It's not that straightforward sometimes.
There's no one single diagnostic test for the disease. Brain scans of patients with Alzheimer's can look different, and symptoms may vary. Most people associate Alzheimer's with memory loss, but Dr. Ho says that's not always the case.
They may have impairment in understanding what they see. They may have impairment in language.
The geriatric cognitive neurologist sees more than a dozen Alzheimer's patients a month, but he says not enough people are getting a diagnosis from specialists like him because not enough primary care doctors are taking that first step.
I think screening needs to be more consistent across the board, and it's something to work on. But yes, again, they are overwhelmed. I would be overwhelmed if I did all the things that they do.
The Alzheimer's Association wants to boost screenings by primary care physicians. San Diego chapter's director of programs, Ana Gonzalez-Seda, says research shows even patients think cognitive assessments are important, but only 16% reported receiving them.
So there is a true gap there. So the physician might not feel competent enough because of lack of training or also time restrictions.
Gonzalez-Seda says the association has an app for physicians to easier screen patients. And they give presentations to doctors explaining how an early assessment can help patients get a diagnosis. They estimate only half of Alzheimer's patients ever get one.
The whole purpose is to educate the staff and to go through the signs and symptoms, also make it easy for them through that application on their phone that they can download and easily access.
She says the other gap is educating patients about the warning signs, especially in the Latino and Black communities where the risk of Alzheimer's is higher. But not enough people are raising the topic with doctors, partly because of the fear they may have it.
People are really afraid to ask those questions and really be honest with themselves.
As the Alzheimer's Association awaits details from the county on how it will spend the new state funds, Dr. Ho is working on improving detection. He also has a small research company where he hopes to collect blood samples from his Alzheimer's patients and design a possible test. He just got approval to begin the study today. Tarryn Mento, KPBS News.